We will talk about right lower abdominal pain. Many diseases and conditions can cause right lower abdominal pain, but when we hear it, first we should rule out appendicitis. It's most important disease because in most cases it requires surgery. That's why we should rule out first appendicitis. What is appendicitis? It is inflammation of part of large intestine. We have this finger-shaped pouch which is attached to the large intestine here, and when we have inflammation of this appendix, it is called appendix. It is called appendicitis. Why this inflammation happens? Happens because of blockage. And what causes this blockage? Usually stool causes this blockage, or some food causes blockage, or inflammation causes blockage. And the pain starts from middle of your belly near navel, and it moves towards right. And pain increases intensity over time. In several hours it increases intensity, and person feels more pain during coughing or during movement or when engaging in activity. So activities, jarring activities causes increased pain. And we have several signs. How we can guess that it's appendicitis. For example, rousing sign. Rousing sign is if you press person to the part of left lower part of abdomen, he feels pain in right part. Another sign is called rebound tenderness. Rebound tenderness means that if you pressure on the abdomen and then release abruptly, intensity of pain increases. That's rebound tenderness. And now let's say why is appendicitis so important? Because it affects around 7% of population. It's huge number of population, and in 80% of cases it requires surgery. So it's very important numbers that 7% of population has appendicitis, and 80% of them will require surgery, because if you left it, it will have complication. This appendix will rupture, and it causes peritonitis, and peritonitis is life-threatening condition. It's important that appendicitis often occur among young people and teenagers, but if it occurs in older people, symptoms can be mild and symptoms can be vague. That's why we should be very careful, because in older people it can be without classical symptoms. That's why we need to be more careful to detect appendicitis. What is diagnostic methods? Ultrasound is first initial approach, initial test, and CT scan gives us more clear visualization of appendicitis. And surgery is solution in most cases. Second most common cause of lower right abdominal pain is kidney stones. What means kidney stones? It means hard deposits of minerals and salts inside kidneys, and sometimes they stuck into ureter and they cause blockage of urine, and they cause inflammation, they cause pain, and the ureter tries to expel this stone, and it contracts, and this contraction is very painful. So kidney stones is very painful for people, and they say that they feel worst pain ever felt. It's so painful. And person tries to move at this case and can't find comfortable position. He feels restless, and it's different from appendicitis. During appendicitis, person tries not to move because he feels comfortable when he is on when he is not moving. It's comfortable for him. But when person has kidney stones, he can't find place. He is restless, and he feels wave-like pains. This pain is wave-like. It means that contractions of ureter. It causes this pain, and it's one of the severe pain person can ever felt. Usually this pain starts from back or side, from this part, and it can radiate into right lower part of abdomen. And if you tap here where is kidneys, if you tap lightly, this pain will worse. It's sign also kidney stones. And ultrasound is first approach, initial test also, and CT scan is another more precise method of diagnosis. Treatment is ibuprofen for pain management if it's not enough, and if there is severe pain, then opioids and alpha blockers also. If there is small stone, alpha blockers can help to relax ureter and to release the stone. And shockwave lithotripsy also is used to degrade these stones, and sometimes surgery is also required. Third most important cause of right low abdominal pain is ovarian cyst. What is ovarian cyst? Ovarian cyst is fluid-filled sac which is on the ovary or into the ovary. Usually such cysts are functional, and women will never know about these cysts because they will disappear its own. It is called functional because they come and go, and it's natural process. It's part of menstrual cycle. But sometimes these cysts increase in size and stay same size for prolonged period of time, and moreover sometimes they rupture and they release this fluid into peritoneum and into abdominal cavity, and they can cause inflammation and sudden and severe pain. So if this ovarian cyst will rupture, it causes sudden and severe pain. Ovarian cyst is problem of women, of course, because men does not have ovaries, that's why. And it can cause also discomfort if the cyst is large enough. If it ruptures, then surgery is required. Another common cause of right lower abdominal pain is gastroenteritis. What is gastroenteritis? It is called also stomach flu. Usually it's viral infection which is caused by rotavirus or norovirus. It can be bacterial infection. Usually they are contagious disease. They spread easily. They cause outbreaks, and they cause crampy and diffuse pain, and they usually not localized in lower right abdomen, but sometimes it happens. That's why we can say that gastroenteritis can cause lower right abdominal pain, but it's not common scenario. At this case, person feels nausea, vomiting, diarrhea, fever, muscle aches, and usually these symptoms will improve in several days, and key here is rehydration, electrolyte solutions, diluted juices, or sport drinks. So you need to intake minerals and water. It's very important. And another cause is irritable bowel disease, irritable bowel syndrome. And irritable bowel syndrome is actually it's hypersensitivity of large intestine, and person feels lower abdominal pain. It's usually not localized to the right side. It's more diffused, but sometimes it can feel as a right lower abdominal pain. Irritable bowel syndrome is characterized by chronic diarrhea or chronic constipation, or alternating between these two. So sometimes we have diarrhea, sometimes we have constipation, and sometimes we have both, and sometimes they alternate. We have a period of time of constipation, we have a period of time of diarrhea. That's the alternation nature of irritable bowel syndrome. And symptoms improve after bowel movement. It's important. So we have pain, we have constipation, or we have diarrhea, and symptoms will improve after bowel movement. And what is treatment? Treatment is avoid trigger foods. Here we have trigger foods usually, and also incorporating fiber into your diet and managing stress, because stress plays important role in irritable bowel syndrome. And another cause, fifth most common cause, is inflammatory bowel disease, or IBD. What is IBD? It's inflammation of large intestine. It can be inflammation of colon. It can be inflammation of whole large intestine, Crohn's disease. And for Crohn's disease, it's more characteristic lower right abdominal pain. And what are the symptoms of inflammatory bowel disease? It's chronic diarrhea, abdominal pain, and sometimes bloody stool. So chronic diarrhea, abdominal pain, and bloody stool is inflammatory bowel disease. What is the treatment? Treatment is anti-inflammatory drugs, corticosteroids, and aminosalicylates. And now let's say other causes of lower right abdominal pain. It can be endometriosis, or pelvic floor dysfunction, or ectopic pregnancy, or diverticulitis. Diverticulitis is more common among older adults, and intestinal herniation also possible. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.